Colorectal cancer is emerging as a growing threat, especially among younger people. As the third most commonly diagnosed cancer and the second leading cause of cancer deaths in the United States. Colorectal cancer affects approximately 1 in 20 cancer patients. Alarmingly, incidence rates are rising sharply, particularly in people under 50 years old. In this article, I aim to provide a comprehensive overview of this disease from potential causes, risk factors, signs and symptoms, to diagnostic tests, treatment options, and most importantly, effective preventive measures to thwart the development of this malicious tumor. The rising colorectal cancer rates among younger populations overturn the conventional wisdom that associates this disease with old age. They signal an urgent need to elucidate the risk factors at play and equip people of all ages with the knowledge and tools to safeguard themselves against this silent killer. By raising awareness and advocating for healthy lifestyles early on, we can stem the tide of colorectal cancer before it exacts an even greater toll. From screening guidelines to warning signs, diet and exercise to emerging treatment, this article covers the disease of colorectal cancer to empower you to catch, fight, and beat it. 1. How to know if you have colon cancer. Spotting early signs of colorectal cancer can be tricky as initial symptoms tend to be vague or mild. At first, small clumps of cancerous cells quietly develop on the lining of the colon and rectum, not large enough to disturb the intestine's contents or normal functions. Hence, patients often chalk up subtle changes like switch in bowel movement pattern or abdominal discomfort to dietary influences or stress. However, as lesions proliferate, they can protrude into the intestinal lumen and cause bleeding or obstruction, leading to more telling symptoms. The signs include frequent urges to defecate but passing little or no stool. This sensation of incomplete evacuation results when a tumor hinders fecal transit. Though not specific to cancer, it warrants attention if it becomes a habit. Pencil-thin, ribbon-like stools. Such abnormal stool shapes happen when developing masses constrict the intestinal canal. Combined with bleeding, it raises real red flags. Intense abdominal pain, cramping, or dull ache may indicate tumor infringement on intestinal nerves and tissue. This compels immediate medical investigation. Blood in or on the stool of fresh red blood or clots signal active hemorrhage from the fragile tumor tissue. Stools may also appear tarry or black from digested blood. Unexplained weight loss coupled with iron deficiency anemia. As cancer progresses, it can sap nutrition and cause occult bleeding. The collective impact manifests as fatigue, breathlessness, and overall frailty. Persistent change in bowel habit, repeated diarrhea, or constipation marks something amiss in the colorectal mechanics. Cancer should feature high on the differential diagnosis. With cancer, vigilance and early action are paramount. If any of the above symptoms last over 2 weeks, prompt diagnostic tests are warranted. These include blood count, stool analysis, CT scan, and colonoscopy. Catching colorectal cancer in stage 1 before it infiltrates deeper tissue can make all the difference to prognosis and survival odds. Hence, heed the subtle cues your body sends as nobody knows it better than you. 2. Tip for early detection. In the early stages, colorectal tumors often bleed subtly into the intestines without causing overt symptoms. However, this occult bleeding can trigger iron deficiency anemia if prolonged. Hence, high-risk individuals like those above 50 years or with a family history should be alert to unexplained anemia, manifesting as fatigue, breathlessness, or abnormal skin pallor. It warrants prompt diagnostic workup for cancer with tests like complete blood count. Low red cell indices indicate anemia, while elevated white cell count may signify inflammation or infection. Fecal immunochemical test detects microscopic blood and stool released from tiny lesions. Colonoscopy visual examination of the entire colon and rectum to identify tumors or polyps. Removal of suspicious growths. Polypectomy can be done during this procedure. Though screening guidelines advocate starting regular colonoscopies at 45 to 50 years. Don't wait until then if you have worrying or persistent symptoms. Early detection of colorectal cancer boosts cure rates significantly. Hence, your best bet is to stay vigilant and explore any unexplained health changes timely. 3. Colon cancer on the left side of the intestine. The location of colorectal tumors can significantly influence their symptom profile. Growths on the right side tend to manifest subtly as the stool consistency is still loose, limiting obstructive capacity unless very advanced. Meanwhile, left-sided lesions cause earlier overt symptoms as stool has solidified, easily blocking narrowed lumen. Main distinctions here: right colon tumors with water absorption incomplete. Right-sided cancers rarely obstruct transit until enormous or metastatic. Gradual onset of anemia, fatigue, paleness from chronic oozing commonly prompts diagnosis instead. Hence these can grow quite sizable before detection. Left colon rectal tumors: as stool solidifies leftward, minor lesions can also clog, causing sudden decrease in caliber of stool. Pencil-thin stools from stricture. Straining to pass little no stool. Sensation of incomplete voiding. Fresh blood coating or mixed within stool. Intermittent abdominal cramps from obstruction. Constant dull pain or tenesmus. So while right-sided colonies go unnoticed more easily, leftward sentinels manifest acutely once the narrowed pipe is breached. Patients may then show up with anemia from visible bleeding or bowel habit changes like constipation, diarrhea. Either way, any persisting odd symptoms for 2 weeks should spark evaluation, physical exam, blood work, stool testing, and scoping. Early discovery bestows better prognosis, so expedient diagnosis and treatment are key. Remember, colorectal cancers yield better outcomes when localized. Hence heed symptoms promptly and ask your doctor if screening colonoscopy is appropriate. For what symptoms might a person experience? As colorectal tumors grow and infringe on the intestinal canal, patients may experience bowel habit changes, constipation or diarrhea, feeling of incomplete emptying, flatulence, distension, cramps, pencil-like stools. These result from obstruction as feces struggle to bypass the narrowing. While not unique to cancer, persistent symptoms in those over 50 warrant evaluation. Rectal bleeding, brighter blood on toilet paper or coating stool. Dark, tarry stools from digested blood. Bleeding typically starts subtly then increases as tumors erode blood vessels. Any visible red flags require urgent assessment. Abdominal pain, dull ache or tenderness in the lower belly. Colicky pain from blocked transit. Sensation varies based on tumor site and size. Constant pain suggests urgent evaluation. Advanced disease, unexplained weight loss from poor intake absorption. Severe fatigue due to chronic blood loss. Liver pain, illness if cancer spread there. Such constitutional symptoms indicate advanced disease. Timely diagnosis and treatment are critical then to improve quality and quantity of life. In essence, heed any lingering change in bowel habits, rectal bleeding or abdominal pain. Prompt evaluation via colonoscopy gives the best outcomes. Though some symptoms like constipation, diarrhea can have benign causes, don't take chances, get checked. Early detection and intervention make colon cancer very treatable. 5. What are intestinal polyps? Colorectal polyps are small, abnormal tissue growths that protrude from the lining of the large intestine. Often benign, most polyps don't cause symptoms initially and are stumbled upon coincidentally during screening colonoscopies. However, some may bleed or trigger changes like constipation, diarrhea as they expand. If spotted, the endoscopist can remove polyps directly during the procedure and send for biopsy to classify as benign, pre-malignant, or malignant. Though typically harmless, certain polyp types bear malignant potential if left unchecked. For example, adenomas, which constitute the majority of growths. Their cells appear slightly distorted under the microscope, signaling mutation. While not full-blown cancer yet, they can slowly transform given an accommodating environment. Likewise tubulovillous and villous adenomas. Thus, while only 5% of adenomas progress to cancer eventually, larger ones greater than 1 centimeter are radically excised even if benign appearing. Their recipients also enter surveillance programs mandating tighter follow-up. So what converts benign polyps rogue? Mainly lifestyle factors that spur inflammation and cellular derangements like obesity, inactivity, smoking, alcohol, processed red meat, and inadequate vegetable intake. Conversely, curbing such exposures and adopting prudent diets higher in fiber, vitamin D and omega oils may suppress lump growth. Nonetheless, current polyposis patients should adhere to customized monitoring as directed by their provider. usually involving colonoscopy every few years or sooner depending on individual risk attributes. The goal is early detection of any funky changes that could be a forerunner to cancer. 6. What factors influence this transformation? Emerging data reveals that diet and lifestyle largely steer the evolution of polyps and their propensity for malignancy. Specifically, patterns high in processed fried fatty meat, added sugar and refinement seem to cultivate cellular chaos. How? By fanning flames of chronic inflammation and revving up biological catalysts of damage like free radicals, circulating insulin, etc. Conversely, clean eats packed with plants, fiber and anti-inflammatory compounds help restore order on a cellular plane. Westernized diets heavy on red processed meats, dairy and cheap carbs get implicated in colorectal cancer for good reason. Their components irritate intestinal walls, impede assigned immune cells, and disrupt gut microbial profiles. This fosters an environment conducive to abnormal tissue growths. Fiber-poor plates also double cancer risk by permitting toxins to stagnate internally too long. Whereas plant-based foods brimming with antioxidants and phytochemicals thwart DNA injury and reinforce cellular repair mechanisms. Their high fiber content further whisks carcinogens out promptly, preventing prolonged contamination. Additionally, shifts like avoiding smoking, maintaining healthy BMI, regular activity and stress moderation help prevent rogue cells from gaining foothold. Some integrative doctors even deploy nutraceuticals like curcumin, green tea and vitamin D against precancerous colon polyps if caught early. The punchline is that embracing broad lifestyle tweaks can make or break one's colon cancer destiny. So whether attempting to prevent first onset or stop progression after initial diagnosis, comprehensive measures targeting dietary upgrades, inflammation reduction, and holistic well-being offer powerful tools to combat this disease. 7. The best way to prevent colon cancer. Experts affirm that prudent nutrition and lifestyle upgrades comprise the best colon cancer prevention. Specifically, plant-focused diets with abundant fruits, vegetables, whole grains, beans, nuts and healthy oils like olive and avocado. These supply antioxidants, fiber and anti-inflammatory compounds to promote vigorous cell health. Limiting red, processed and fatty meats which can stimulate inflammation, weight gain and other detrimental cell changes. Maintaining healthy body weight through routine activity and avoiding obesity. Exercise enhances gastrointestinal function and immunity besides controlling weight. Undergoing regular checkups and screening tests like colonoscopy around age 50, sooner if high risk. Detecting precancerous polyps early allows removal before malignancy. Managing coexisting illnesses like diabetes and high BP optimally. Their presence quickens cellular aging including DNA damage that spurs cancer. Adopting stress-relieving practices like yoga and meditation. Chronic stress accelerates biological aging and tissue inflammation raising cancer risk. Ceasing tobacco use and limiting alcohol intake which are directly carcinogenic. In summary, colon cancer is highly preventable through lifestyle tweaks. Like plant-based diets, active living, polyp surveillance, and holistic wellness. Instituting positive changes improves your risk profile regardless of age or family history. Work closely with your doctor to create a customized prevention plan catering to your health status and needs. Consistent adherence promises huge protective payoffs. 8. Risk factors for colon cancer. Several factors heighten one's risk of developing colorectal cancer, family history. Having a first-degree relative with colorectal cancer doubles your risk as certain gene mutations get passed down. Age over 50 years when cancer rates accelerate. However, more young adults are now being diagnosed before 50. Inflammatory bowel diseases like Crohn's or ulcerative colitis. Chronic intestinal inflammation paves the way for malignancy. Benign growths like polyps, adenomas or inflammatory polyps signify increased predisposition. They may slowly transform into cancer. Diet high in processed and fatty meats, low in fruits and vegetables fiber. Such patterns promote weight gain plus inflammation aiding cancer progression. Sedentary lifestyle and obesity which encourage hormonal and immune changes that spawn cancer cells. Tobacco smoking which contains multiple carcinogens that harm colon tissue DNA. Heavy alcohol consumption also irritates the bowel lining besides producing carcinogens. Type 2 diabetes, high cholesterol indicating disordered metabolism, and possible insulin resistance, also up colon cancer risk. Knowing your risk factors allows strategic moves to minimize their impact through diet, exercise, wellness, and screening tests. 9. Foods and habits to prevent colon cancer. To minimize colon cancer risk, experts advise plant-centered diets, fruits, vegetables, whole grain supply vitamins, minerals, fiber, and plant compounds like flavonoids and carotenoids that bolster immunity, combat inflammation, and neutralize toxins. Beans, lentils provide protein and soluble fiber that feeds good gut bacteria producing anti-cancer compounds. Nuts, seeds, and their oils, olive, avocado, flax, hemp deliver healthy fats and nutrients that curb inflammation and oxidative stress. Herbs and spices like turmeric, ginger, rosemary, garlic contain antioxidant and anti-inflammatory agents that protect cell health. Limit red meats and ultra-processed foods. These foods spur inflammation, insulin resistance, oxidative damage, and other cancer-feeding changes. Suspect additives include nitrites, emulsifiers, artificial flavors, colors. If consumed, choose organic, grass-fed varieties which have superior nutrition profiles. Also restrict portion sizes. Stay hydrated and active. Ample hydration keeps bowel movements regular, swiftly removing toxins while preventing constipation. Routine physical activity maintains healthy weight, lowers cancer-promoting hormones and compounds, and boosts immunity. Yoga, meditation, and sound sleep further reduce inflammatory stress chemicals. Undergo regular screenings, colonoscopies, discovery and removal of precancerous polyps before malignancy develops. Monitoring growths is also possible. Newer stool DNA tests also effectively detect cancer markers from cells sheeted in feces. Testing enables earlier diagnosis for better prognosis. But cancer prevention via healthy living remains the best path. In summary, pairing prudent nutrition and lifestyle with medical surveillance gives a winning edge against colon cancer. 10. What is colonoscopy? Colonoscopy involves using a slender, flexible, lighted tube to visually examine the full length of the colon and rectum. It serves several purposes. Screening. It can detect early cancerous, precancerous lesions like polyps and allow their removal before malignancy develops. This prevents up to 70% colon cancers. It should be considered starting age 45, earlier if high risk. Frequency varies based on personal or family history. Diagnostic. It helps evaluate signs like rectal bleeding, iron deficiency, anemia, or altered bowel habits that raise cancer suspicion. It provides definitive diagnosis by allowing biopsy of suspicious tissues. Surveillance. People with histories of polyps, colon cancer, or inflammatory bowel disease need closer monitoring as they face heightened risk of recurrent lesions of cancers. Preparation. The colon must be thoroughly emptied the day prior by consuming a liquid diet and strong laxatives. This clean-out enables optimal visibility. Procedure. It involves gently inserting a thin, bendable, telescope-like tube via the anus to scout the entire 6 feet of the colon lining. Mild sedatives are administered to minimize discomfort. The procedure lasts 15 to 30 minutes. Aftercare. Light diet and fluids are recommended for 1 to 2 days to rest the bowel, which may remain irritated. Serious complications like perforations or major bleeding are uncommon but require prompt hospitalization if they occur. By enabling early detection and removal of cancer-fated tissues, colonoscopy represents a valuable deterrent against colorectal cancer when judiciously utilized. Alarmingly, colorectal cancer rates are escalating sharply. However, if detected early, survival exceeds 90%. Therefore, individuals should adopt prudent lifestyle habits and undergo age-appropriate screenings like colonoscopy and stool tests for early identification. Though screening benefits those 50, younger adults may also require evaluation if symptomatic. Additionally, subscribe for more educational health videos that empower your self-care journey.